Hello, my name is Mona Despani, and I'll be giving a report today on a 71-year-old female who came in for a head to toe assessment. First, she started off by telling me her name, which was Miss Uradell. Then she gave me her age, which was 71 years old. She was alert and oriented times three. She had a good nutritional status, and she had access to 3 meals a day. Her BMI was appropriate for her height and her weight. As she walked in, I noticed that she had a good mobility, a good gait, good posture. No physical deformities or abnormalities was noted. She even admits that she doesn't have any deformities. Her posture was upright and straight. She was in a good mood today. She also states that she's very happy and she always in a good mood. Her speech was clear and appropriate. Her natural language is English, and she was nice and clean on today. I started off with her skin, her hair distribution, color, and was appropriate for her race, ethnicity. Her skin was warm and dry to touch. Her hands was nice and clean. Nail beds was clean. Capillary refill was less than 3 seconds. Peripheral pulses was palpable. Her brachial and radial pulses was palpable. Next, I moved to her head. I checked her scalp, which was nice and clean. No infestations, redness, or irritations. Dandruff was noted. Her hair was gray in color and clean. She denies any tenderness to palpation. No lumps, bumps, or bruises was noted. Then I inspected her face. Her face was nice and symmetrical, which is cranial nerve 7, facial nerve, and all her other cranial nerves 1 to 12 was all intact. Her temporal artery was also palpated. No thrills was noted. During palpation, she denies any tenderness to her frontal and maxillary sinuses. Um, then I inspected and palpated her neck. I moved to her neck, uh, which was negative for any pulsations or lumps, bumps, or bruises. She denies any tenderness to palpation to the trachea or the neck. All lymph nodes was palpated and non-tender without any swelling or enlargement. After that, I checked her carotid arteries. Inspection was noted. No lumps, bumps, or bruises, or thrills or pulsation. I checked them one at a time, which were palpable. Then I auscultated the bilateral sites, and they were without any murmurs or thrills. Next, I checked her cranial nerve 11, which is her spinal accessory muscles, um, which was intact with full range of motion against resistance. Her trachea was midline, um, and she denies any tenderness to her neck area. Then next, I moved to her eyes, which is the optic nerve, which is cranial nerve 2. Her sclera was white. Her pupil was brown. Her pupil was black. Her cornea was inspected. Cardinal inspection was done to the side, and it was intact and concave. No problems with that. So then I moved down to her eyelids. I checked her external structures were clear. There was without any irritations. Her eyebrows, her eyelids, and eyelashes. Her conjunctiva was nice and pink. Her pupils was equally round and reactive to light and accommodation. Next, I checked her ears. All the external structures of her ears was without any drainage or irritation. She denies any tenderness to palpation. Her nose was midline, good in patent. It was good in patent bilaterally. No drainage was noted to her site and her nose on the outside of her nose. The mucosa was pink and the septum was midline. Next, I inspected her lips. Her lips was not cracked. No irritation was noted. No lesions was noted. Her mucosa, teeth, gums, tongue, hard and soft palate. Uh, no lesions was noted there as well. Her tonsils, they was all moist, without exudate. Her thyroid was palpated as well, and that was non-tender. No swelling or or lymphadenopathy was noted. Next, I inspected her lungs. The posterior inspection with and AP and T was within diameter. Her scapula and her spine was midline. Her anterior inspection with no use of accessory muscles was noted. Her respiration was unlabored and 18 beats per minute and regular. Then I checked her CVA and it was negative for CVA or tenderness. She denies any tenderness to palpation. Her lungs was clear upon auscultation to all lung fields, both anterior and posterior. She denies any tenderness to the site. Her heart sounds was auscultated both lying and sitting, and it was all auscultated with no murmurs noted. No murmurs or thrill noted. S1 and S2 was noted. Her heart rate was regular, and the apical pulse was 60 beats per minute and palpable. It was palpated at the fifth intercostal space, a little to the left near the mitral area, mitral valve. Next, I inspected her abdomen. It was round. Her abdomen was round and symmetrical at eye level. I got at the eye level. Her abdomen was symmetrical, round and symmetrical. The contour with good contour. Her color was good for her race. She didn't have no scars was noted, and everything was symmetrical. No striations noted, no scars noted, no no physical paras no physical peristalsis or pulsations was noted. Her umbilicus was midline. Bowel sounds was present in time 4 quadrants with no problems. Timpani to percussion was noted to all the regions of her abdomen. It was negative to light and deep palpations through all her regions of her abdomen. Next, I went to her lower extremities. Her skin was the color of her skin and the characteristics of her skin was good. It was warm. She had good hair distribution. No edema or varicose veins was noted to her lower extremities. All her peripheral pulses was palpated. Her femoral, her popliteal, her posterior tibial, and her dorsalis pedis was palpated, and they was all within normal limits. And then she had full range of motion to her upper and her lower extremities. She had good muscle strength to both her upper and her lower extremities. With good, she had a good hand grip. No problems with that. Then I checked her heel to shin test, which was negative. Her patellar reflexes was positive with a +1. The Romberg test was negative. She had maybe slight swing, not much, and her scoliosis screen was negative. Um, and everything that I checked pretty much within normal limits. And this is the end of my report. Thank you.